Top 3 exercises to get rid of your knee pain. There's lots of exercises we can give you to get rid of your knee pain. I'm going to give you some basic ones that should help you out no matter what's causing your knee pain. If you're having any pain with any of these exercises, then obviously don't do them, but this should help. So this first exercise is called a sit to stand. It's kind of similar to a squat. We want to try to work on the mechanics of the knee on this one. So it's not important that you have a bunch of weight in your hands or on your back when you do a squat. It's important that you're doing it properly. So the thing that I want you to remember is toes straight, knees out. In general, you want your toes kind of straight ahead. You can have a little bit of out toeing, like 10 to 15 degrees of out toeing, but right straight ahead is where you want it to be for most people. And you want to have your knees out. So we say kind of knees towards the outside edges of the feet. What we typically see a lot of is people will turn their toes out and then they go to stand up and they turn their toes out to get a wider base of support so they have better balance. The problem with that is it's really hard to stand up without your knees collapsing in like that. And that's the position we want to avoid. Toes straight, knees out, just going, like kind of leaning your chest forward, going from sitting to standing, and then same thing on the way back down. Some people do really well when they stand up. They keep their knees out, toes straight ahead, and then as they go to sit down, they might have that medial kind of knee collapse, which you want to try to avoid. You want to try to keep these knees in good alignment, keeping toes straight and knees out when you go up and when you come back down. 2 more exercises. This is a general exercise for strengthening up the muscles in the back of the hip. So it's called a bridge. And from here, all you're going to do is, again, toes straight, knees out. You're going to lift your hips up off the ground as far as you can go. You can do this typically on floor, carpet surface, on your bed. The bed's probably going to be a little bit too squishy and move a little bit, so try to have something that's a little bit firmer surface. And you're going to push down, hips up as far as you can go. So there's a big difference between lifting your hips here and then getting these hips up higher. And you should feel that in the backside of your hips. The difference here, muscles aren't working as hard. Up to here and the backside of the hip, you should feel those muscles kind of turn on. That's the feeling that you want to have. So just kind of holding it up here and then returning to where you started. Last one I'm going to give you is a clamshell exercise. So from here, you're going to lay onto your side, and hips are in line with your knees. Your heels are together, and you're just going to kind of squeeze your heels together. And you're going to separate your knees. Now what most people do is they'll go to separate their knees and they'll open up their entire hips. This top hip will kind of roll back. What you've got to focus on is really keeping that hip forward. So I tell people, kind of put your hand on your hip. You don't have to push it forward a lot. Just make sure that it doesn't go back when you do this exercise. So hip forward, knees together, heels together. Squeeze your heels just a little bit. And then separate your knees, and you should feel this right in the backside of the hip. If you feel it somewhere else, then try to shift that hip forward or kind of move the position of your knee a little bit. When you get this up at its highest position, then you want to feel that right in the backside of the hip. You can add resistance to this. If you have a band at home, you can put a resistance band around your knees, and that will make that a little bit harder. But those are 3 exercises you can do to try to get rid of your knee pain.